Tired of dealing with annoying flies, fruit flies, and gnats in your home? The Zevo Flying Insect Trap is your ultimate solution. Don't wait. Check out the link in the video description now to get your Zevo Flying Insect Trap on Amazon and enjoy a bug-free home today.
A virus found in sloths and spread by mosquitoes in South America has now been found in the U.S. The U.S. Centers for Disease Control, CDC, has issued a warning about the Oropouche virus after 11 Floridians returned from summer travel with the disease. The condition is spread by mosquitoes in tropical parts of the Caribbean and South America, and causes fever, rash, joint aches. In rare cases, it can cause brain swelling and death, and claimed the life of 2 healthy Brazilian women earlier this year. In 2024, there have been more than 8,000 cases reported in Central and South America, causing 2 deaths, 1 miscarriage and 4 newborns to be born with birth defects. 19 cases were reported in Europe earlier this month, leading to a warning from the European Center for Disease Control. The US CDC's warning was specifically addressed to doctors and public health authorities, asking them to test people who've returned from a Latin American vacation this summer for the virus. The Oropouche virus is spread by mosquitoes and a bug called a midge, which is a small, blood-sucking winged insect. Despite its nickname, sloth fever is not caused by coming into contact with sloths. Instead, it got the nickname because scientists believe sloths can carry and be infected by the disease. Experts suspect other animals, like birds, can also carry the virus. If you get bit by a bug carrying Oropouche, there are no medicines to treat it and no vaccines to prevent it. The only defense against the disease is to avoid being bit altogether when traveling to these regions. The CDC recommends wearing long sleeves and pants, wearing insect repellent and staying in places that use window and door screens. Common symptoms include fever, severe headache, chills, muscle ache and joint pain, according to the CDC. Less than 1 in 20 people who get the disease will go on to develop more serious, life-threatening symptoms. These include severe bleeding, meningitis, a swelling of the membranes that protect the brain, and encephalitis, a swelling of the brain itself. It can also cause birth defects and miscarriage. The 4 babies reported in the CDC's letter were born with microcephaly, a condition where the brain and skull of a newborn is much smaller than it should be. As such, the CDC letter urged pregnant women to reconsider potential travel plans to the area. Aside from transmission during pregnancy, the virus cannot spread between humans. Cases have been reported in Brazil, Bolivia, Peru, Colombia, and Cuba. All cases reported in Europe and North America have been in people who have recently traveled to one of those countries. Medical entomologists Cameron Webb, from the University of Sydney and Andrew van den Herk Medical from the University of Queensland, said this has been a local concern for years, but it's the first time it's drawing international attention. The situation is reminiscent of the Zika outbreak in 2015-16, Professor Webb and Professor van den Herk said. Dr. Danny Altman, a professor of immunology at Imperial College London, told The Telegraph, "We should all be worried." He added, "Oropouche is certainly a worry for its uncertainty and, for all those worried about global health, it just feels like climate change is adding to the healthcare burden in a very palpable way, season by season."